Hello, friends. Welcome. And let us start with a new discussion: bipolar disorders. The recurrent episodes of mania and depression in an individual are referred as bipolar disorder. Remember, the episodes of mania and depression are recurrent, and individual alternates between the manic state and the depressive state. And if you want to define bipolar disorder, in other words, the episodes of unusual shift in mood from one end of behavioral continuum to another. So what's a behavioral continuum? This is the behavioral continuum about which I am talking. At the one end of this, there's a depression, which has been shown in deep blue color, and the just another extreme end, it's a mania in the deep red. And we mentally healthy people just fall between this behavioral continuum, whereas the individual who suffers from the mood disorders likely to fall either on the extreme end of this behavioral continuum or alternate between these two extreme ends. Remember this image in your mind, because this will help you out in understanding the concept of bipolar disorders. It's a kind of expression of alternating intense emotional behavior, that is the emotional feeling. The individual who have the intense feeling of either mania or the depression, which feeling when manifest in the form of behavior, then we can term that individual is suffering from the bipolar disorder. So that was all about the definition and something, the crux of bipolar disorder. The bipolar disorder, a psychological disorder, also known as the manic depressive disorder. It has a second name, that is the manic depressive disorder. In this mental condition, the unusual shift of mood occurs from depressive to manic or vice versa within short period of time. Rapidly, this alternating mood states occurs. The alternative mood swings seriously not affect the psychophysiological functions, also the social and the professional output and the relations. Along with the mood, the energy and the activity level also changes. During the manic stage, the individual experiences the high level of energy. During the depressive stage, the energy level goes down. Similarly, activity level. It is typically accompanied by serious impairment in work and social functioning. Obviously, when the change, and that is rapid, that occurs between the two mood states and that have its bearing on the energy and activity level, certainly it's have a detrimental effect on the your professional output and the social relations. For the ease of understanding and the management of the BPD, that is bipolar disorder, it has been classified into categories. So what are that categories? First one, bipolar 1, that is appearance of at least one manic episode. If an individual expresses or manifests at least one episode of mania, and if that occurrence is within the diagnostic criterion, we can safely designate that individual is suffering from the bipolar disorder type 1. Bipolar type 2, at least one major depressive episode, at least for 2 weeks. This is a major criterion. They also have at least one hypomanic episode that last minimum for 4 days. That's a very important point we must understand as far as the bipolar 2 type of BPD is concerned. At least one episode for 2 weeks of depression and one episode of hypomania. If it is hypermania, then it's okay, but it has to be hypomania at least for continuously for 4 days. The third type is the cyclothymia. If you look at the word cyclothymia, the prefix is the cycle. Cycle means there is a alternating between the two states. But that alternating experience of either manic or depressive state has to be in continuum and the intensity has to be lower. The cyclothymia contains the episodes of hypomania and depression are shorter and less severe than the mania and depression caused by the bipolar 1 or the bipolar 2 disorder. Here the difference is the intensity is lesser and the experience duration is also shorter. Now, what is diagnostic criterion? For the manic episodes, a span of abnormally and persistently elevated, expansive or irritable mood lasting at least 1 week and present most of the day, nearly every day. The first symptom. During the period of mood disturbance, 3 or more of the following symptoms should be present in an individual before diagnosing him for the BPD. So, what are these symptoms? Inflated self-esteem or the grandiosity, decreased need for sleep, more talkative than usual behavior, flight of ideas or racing thoughts, easy distractibility, excessive involvement in activities that have a high potential for painful consequences or the risk. The mood disturbance is sufficiently severe to cause marked impairment in daily life, in professional life, in social life. So, out of these symptoms, if individual expresses 3 or more than 3 and for at least 1 week, then we can safely diagnose an individual with BPD type of disorder. Other way around, the diagnostic criterion for the depressive episodes. Here is a difference between the manic and the depressive diagnostic criterion. For the manic, it was 1 week, whereas for depressive, it is 2-week period. And the individual has to express or the experience at least 5 or more symptoms. Depressed mood. So, the indicators of depressed mood are individual becomes sad, loves to remain lonely, always remain within the self, experiences hopelessness, helplessness, feeling of emptiness. So these are the indicators of depressed mood. Then diminished interest in pleasure in almost all activities. The activities that have a pleasurable consequences, the depressed individual never enjoys that. Significant weight loss or the weight gain. So what does significant means? For example, in a month, if individual loses or gain 5% of the body weight, certainly it's an indicator of the depressive state. Remember, individual either loses the weight or the gains the weight. So both the condition occurs in the depression. Insomnia or the hypersomnia nearly every day. Either individual find it difficult to sleep or difficult to wake up. Experiences fatigue or loss of energy nearly every day without engaging in any physical activities. Even individual feels difficult to raise hand, to open the eyes, to move the head, because there is a perceived loss of energy, and individual feels not interested to engage in the body movements or the motor activities. Along with that, there's a feeling of worthlessness or excessive or inappropriate guilt that sometimes leads to the suicide ideation. And remember, the individual who suffers from the depressive episodes are more prone to committing the suicide than the manic type of individuals. This is a landmark difference between the manic and depressive types. Diminished ability to think or concentrate and indecisiveness. This is a common symptom found in individuals who are suffering from the mental disorders, because during that it becomes difficult to concentrate on all the aspects of a problem or on activities, and consequently it becomes difficult to take decisions. Making judgments become difficult too, and recurrent thought of death and recurrent suicide ideation, sometimes committing of suicide too is possible in depressive episode. Hence, out of these symptoms, if an individual expresses 5 or more than 5, remember, for 2 weeks continuously, then it is safe to say individual is suffering from the depressive episodes, maybe from the bipolar disorder. What are the salient features or the characteristics of BPD? The mean age at which BPD shows is almost 25 years. Very disturbing trend. During the onset of the adulthood, the symptoms of BPD start appearing. Means the young people are more prone to feeling of manic or the depressive state, and that may lead to the development of bipolar disorder. The depressive episode lasts for 2 weeks and the manic episode lasts for 1 week. During the experience of bipolar disorder, individual experiences disbalance of psychophysiological energy. Why the word disbalance is? Either it goes to the extreme lowest or goes to the extreme highest. The balance of psychophysiological energy system goes for the toss. Mood swing is a common phenomena or the common thread of bipolar disorder. There is a noticeable departure from the normal behavior. The genetics, environmental factors such as the stress and the traumatic experiences and some disturbances in the brain structure or the brain chemistry are the major causes of the bipolar disorder. Yes, you have heard right. There may be genetic predisposition for the bipolar disorder. There may be environmental factors. Experience of a high level of stress and continuous stress may lead to the development of the BPD. Now let us throw some light on the functional consequences of BPD. What does functional consequences means? The individual who suffers from the BPD have some impairment in the psychophysiological, including the social functions. First, it impairs the individual's capacity to do things quickly and efficiently. This means the efficiency of the individual is compromised, along with the speed of doing activities. Then the mood swings leads to difficulty in concentrating, sleep disturbances, decision making, judgment making, rational thought process, logical thinking, problem solving, etc. This means your all executive functions regulated by the prefrontal cortex are compromised. Leads to psychological fatigue, a kind of cognitive tiredness due to excessive usage of the limited cognitive resources. Then the individual who suffers from the BPD is likely to be attracted towards such behaviors which are dangerous, which are risky, which may have negative consequences, such as drug abuse, alcohol, too much spending, doing risky activities. For example, nowadays people are engaged, specifically young people, in taking these selfies in front of running trains. I am not saying that these people suffer from the BPD, but certainly it's a kind of risk taking. And the risk taking, which is illogical one, indicates some kind of mental deficiency. That much I am sure. Now, can we manage the BPD? Can we treat the patient? Yes, it can be managed and it can be treated too. There's a standardized protocol for the management of the BPD. The appropriate medication suggested by the psychiatrist and the behavioral therapy suggested by the psychologist jointly can cure this mental illness. The cognitive behavior therapy. What is that? The modification of maladaptive cognitions. Medications such as the antidepressants. Yoga. You know, Karo Yog, Raho Nirog. New York University Grossman School of Medicine found in the research that yoga is a very important preventive and curative technique for the management of various type of mental disorders. Then relaxation techniques, which are the gift of yoga, that is the breathing exercises, relaxation strategies and meditation practices, helps in not only managing the BPD but restoring the psychophysiological balance of the individual. And combination of psychotherapy, medication or the relaxation techniques helps in treatment of the BPD and management too. The best part is the preventive technique, and out of that yoga has been found to be the best one. Dear friends, that's all for the BPD, and these are my references. If you want to gain deeper insight into the BPD, just refer them. By the way, if you like the contents and the presentation style of this video, tell to others. But if you have any question, any queries or any comment to make, just drop a comment in my comment box, or you can email me at vamasujit@yahoo.com. But never forget to watch my next video on schizophrenia. Thanks for watching.